Diabetes is a very common disease around the world, and the number is only increasing. About 537 million adults of age from 20 to 79 years old worldwide have this condition, which is about 10.5% of this age group. Type 2 diabetes is the most common form and represents about 90 to 95% of all diabetes cases. Although most people tend to manage it well, it's still a health issue, and we should adopt ways to help us avoid getting it in our lives. But something even more important is its detection. There are some signs of having diabetes that you can notice and consult your doctor for its management. Let's have a look at 11 early signs and symptoms of diabetes in today's video that aren't commonly talked about, but can indicate this underlying condition. Number 1. Darker skin on the neck. Normally, the skin on our neck should be the same color as the rest of the body, but if it's not and you start noticing a darker, velvety patches of skin on your neck or even in areas like your armpits or groin, then it could be a sign of diabetes type 2. There is a name for it as well, and it is acanthosis nigricans. The condition arises mainly because your body is becoming resistant to insulin, the hormone that regulates blood glucose level. The darkening happens because there's now more melanin here, which is the skin pigment. Although this darker skin is usually harmless, but it can indicate that your blood sugar levels are out of balance. Number 2. Recurrent infections. Normally, the human body should be able to fight off common illnesses, but if you're constantly battling infections, whether it's skin infections, urinary tract infections, or even gum disease, it could be a sign of diabetes. High blood sugar levels weaken your immune system, making it harder for your body to fight off bacteria and heal itself. This means infections can happen more often and take longer to clear up. For example, people with diabetes are more prone to yeast infections, especially in warm, moist areas of the body. If infections keep coming back or take a long time to heal, it's worth getting your blood sugar checked to rule out diabetes as a cause. Number 3. Vision changes. Another important indication of having diabetes is having issues with your vision. This is why the first question that your eye doctor asks is whether you're diabetic or not. You see, high blood sugar affects the fluid levels in your eyes, which can make it hard to focus and cause temporary vision changes. If the high sugar levels are left unchecked, it can damage the tiny blood vessels in your eyes, leading to more serious problems like diabetic retinopathy, which can cause blindness. If you notice sudden shifts in your eyesight, especially if it gets blurry or you see spots, it's important to get your eyes and blood sugar levels checked. Number 4. Lightheadedness. Feeling lightheaded or dizzy, especially after standing up quickly, can be a sign of diabetes. This happens when your blood sugar levels fluctuate too much, either dropping too low or being too high. Low blood sugar affects your brain's ability to function properly, making you feel faint or unsteady. High blood sugar, on the other hand, can lead to dehydration, which also causes dizziness. If you're frequently feeling lightheaded, it could mean your body is having trouble regulating blood sugar, a key indicator of diabetes. Paying attention to this symptom and monitoring your blood sugar can help you stay balanced and avoid bigger issues down the road. Number 5. Sexual dysfunction. Sexual dysfunction, including erectile dysfunction in men or reduced sexual desire in both men and women, can be an unexpected sign of diabetes. High blood sugar can damage blood vessels and nerves over time, affecting blood flow to vital organs, including the reproductive system. This damage can make it difficult to maintain an erection or experience normal sexual sensations. For women, vaginal dryness and difficulty in arousal can occur. If these problems become frequent, it could be a sign that your blood sugar is too high. Managing diabetes through lifestyle changes and medication can help improve sexual health and prevent further complications. Number 6. Irritability. Feeling unusually irritable or moody can also be linked to diabetes. When blood sugar levels swing up and down, it affects the brain and can lead to mood changes. Low blood sugar or hypoglycemia can cause feelings of anxiety, shakiness, and irritability, while high blood sugar hyperglycemia may leave you feeling sluggish and grumpy. The constant fluctuations can be frustrating and emotionally exhausting, leading to short tempers or emotional outbursts. Number 7. Weight loss. Unexplained weight loss can be an early sign of diabetes, especially type 1. When your body can't produce enough insulin or use it properly, it struggles to convert sugar into energy. As a result, it starts breaking down fat and muscle for fuel, leading to sudden weight loss even if you're eating normally or more than usual. This weight loss can happen quickly and without even trying. If you feel a loss in weight unexpectedly and feel more tired or hungry than usual, it might be a signal that your blood sugar levels are too high and your body isn't getting the energy it needs. Number 8. Itching. Persistent itching, especially in areas like the hands, feet, or groin, can be a surprising sign of diabetes. High blood sugar can lead to poor circulation, especially in the skin, which causes dryness and itching. Diabetes can also lead to skin infections, such as fungal infections, that cause intense itching. Additionally, when your body starts spilling excess sugar into your urine, it can cause irritation and itching in more sensitive areas. If you notice frequent or unexplained itching along with other symptoms, it's worth getting your blood sugar checked to see if diabetes might be the underlying cause. Number 9. Fruity smelling breath. A sweet or fruity smell on your breath can be a sign of diabetic ketoacidosis, a serious complication of diabetes. When your body doesn't have enough insulin to use sugar for energy, it begins breaking down fat instead. This process produces ketones, which can build up in the blood and cause your breath to smell fruity, similar to nail polish remover or even ripe fruit. This is more common in people with type 1 diabetes, but can happen in type 2 as well, particularly if blood sugar levels get dangerously high. Number 10. Pain in your limbs. Pain, tingling, or numbness in your hands, feet, or legs can be an early sign of diabetic neuropathy, a complication caused by high blood sugar levels. Over time, elevated blood sugar can damage the nerves, especially in your extremities. This nerve damage can feel like sharp pain, burning, or pins and needles sensation, typically starting in the feet and moving upward. If left untreated, the pain can worsen and lead to a loss of sensation, making it difficult to feel injuries or infections. If you're experiencing unexplained pain or discomfort in your limbs, it could be a warning sign of diabetes, and catching it early can help prevent further nerve damage. Number 11. Dry mouth. A persistently dry mouth, or xerostomia, can be a symptom of diabetes. When blood sugar levels are high, your body tries to eliminate the excess glucose through frequent urination, which can lead to dehydration. As a result, you may feel an unquenchable thirst and have a dry, sticky feeling in your mouth. This dryness isn't just uncomfortable, it can lead to other problems. Saliva plays a key role in keeping your mouth healthy by washing away food particles and bacteria. So, when there's not enough, you're more prone to cavities, gum disease, and bad breath. You might also find it harder to chew or swallow food. If you're constantly thirsty and experiencing dry mouth despite drinking plenty of fluids, it could be a sign that your blood sugar levels are too high, and you should consider seeing a doctor. I hope you can avoid developing diabetes altogether, or if that happens, you can manage it well so it doesn't affect your lifestyle as much. And that's it for today. If you enjoyed this video, then make sure to check out the next one shown on screen. Thanks for watching.